We're back again, and thank you all for those of you who are just tuning in, welcome, and for those of you who have been here, thank you for sticking around. This is the fifth session of this webinar, and we're going to be discussing approaches to casework and current research. The three of us on this presentation are all currently engaged in research focused on gender diversity in forensic anthropology. The first half of this talk will review Amy and my research alongside the TDTF, which focuses on identifying and centering transgender and non-binary decedents in forensic anthropology casework. We'll also be offering some suggestions for harm reduction practices in forensic investigations. The second half, we'll turn it over to Taylor Flaherty, and she will highlight her research on factors to consider when planning equitable death care in cases involving potential trans decedents, and finish up with an overview of current research that is focused on issues related to the identification of trans individuals. At the time of this webinar, as we've heard in a few presentations today, today it is 89 days into 2021, and at least 16 transgender people that we know of have been murdered or died by suicide this year in the US. And that number is 88 worldwide for this year. In 2020, a record number of homicides of trans and non-binary people occurred across the globe, and the US is on track to meet or exceed this figure in 2021. This violence is disproportionately targeted at young individuals of color. At the time of this presentation, there were also 40 anti-trans bills being considered in 25 state houses in the US. Clearly, the forensic significance of this population is set against the backdrop of a rise in transphobic policymaking and increasing hate crimes. Specific data and statistics on violence towards trans individuals is difficult to gather, and it's often undertaken by advocacy groups due to underreporting and lack of adequate record keeping by local law enforcement. This is an issue that we see as parallel to the crisis of missing and murdered Indigenous women in North America. But what we do know from public health data is that transgender individuals face disproportionately high rates of fatal violence and are therefore likely to be overrepresented in forensic cases. This is a screenshot from the LAMP database, which Jesse discussed in session 3 of this webinar. For those of you who were not there for that, this is a searchable case map with pinpoints representing one unidentified or missing person. Right now, we're filling in the US data, but have started to expand globally. The project started just last year, and there's over 200 researched cases in the database, which shows you the magnitude of the problem of violence against LGBTQ+ people. Given the likelihood that we will encounter transgender and non-binary decedents in our forensic anthropology casework, and given the unique challenges that are associated with these cases, it's important to consider how we'll approach them. We will be addressing the following questions in this session of the webinar. What factors should we consider when planning for equitable death care? What are our ethical responsibilities as forensic scientists or death investigators? What strategies can we employ to reduce harm in these cases? And what type of research could we do that might help address the problem of identifying trans individuals? So to address that first question of planning equitable death care, we propose the application of a structural vulnerability assessment. First, to define structural vulnerability, it's defined as a positionality that imposes physical or emotional suffering on specific population groups and individuals in patterned ways. Essentially, we can think of this as class-based economic exploitation, as well as discrimination that are entrenched within the structure of our society, intersect to make certain individuals from marginalized groups particularly vulnerable to physical and emotional harm. Recognizing signs of structural vulnerability, as well as the specific factors that make people vulnerable, are key to planning equitable care. Structural vulnerability assessments have been applied in healthcare settings to identify vulnerable patients and the particular ways in which they are vulnerable, so that providers can plan care to meet their specific needs and circumstances. Recently, Soler and colleagues proposed applying a structural vulnerability assessment to death care in forensic cases involving the identification of decedents from marginalized groups. They were specifically focusing on issues inherent in identifying undocumented migrants, but these issues are parallel to those that exist in trans cases. Soler and colleagues originally applied a structural vulnerability framework to the problem of identifying the remains of undocumented migrants. And this chart is just comparing their findings in migrant populations to our findings in the identification of trans people. As members of structurally vulnerable groups subject to discrimination and marginalization, there are similar challenges faced in identifying undocumented migrants as well as trans decedents. For undocumented migrants, it's often difficult to locate antemortem records if they exist in another country or if the antemortem records in this country are tied to an alias. With trans decedents, a parallel issue is that of dead names. A name a trans person was given at birth but no longer uses because it doesn't reflect their identity. Perhaps most notably, public outreach and new collaborations are increasingly important, as anthropological methods alone, as we've discussed, can't always resolve identification, especially of marginalized group members who may not have been reported missing or may not have antemortem records to use in identification comparisons. Understandably, members of marginalized groups may also distrust or fear governmental or legal authorities. This is a well-documented problem in migrant communities. And with LGBT plus community members, we often see victims who may not have had close biological family, but had chosen family members. However, for a variety of legal and cultural reasons, those chosen friends and family may not want or may not be able to come forward at the time of their loved one's disappearance or death. Family acceptance of identifications is also not as straightforward as we may hope for in forensic cases involving trans decedents. If a family doesn't accept that person's gender identity, the path towards identification and returns of remains could be complicated. And finally, assessments of indicators of structural vulnerability might help anthropologists recognize potential trans cases, as well as to understand and plan for the unique challenges of identifying these individuals. So what might application of a structural vulnerability assessment look like? And why should we implement this framework for trans cases? First, understanding structural vulnerabilities is important because it can help guide our next steps and best practices in forensic casework. And this will ultimately help us better serve trans decedents in our care. Second, assessing indicators of structural vulnerability might also help anthropologists potentially recognize trans cases. Physical bodies, the bones themselves, may record the biological consequences of structural vulnerability. We know that that vulnerabilities can also manifest in the case file in lack of available antemortem records, as well as in bias and misrepresentation in initial reports and unidentified persons databases. Jesse did a fantastic job about talking about some of these issues in session 3. We emphasize intersectionality in our work too. Besides gender, multiple aspects of an individual's identity, including race, class, disability, sexual orientation, and physical appearance, interact to influence their life and death experiences. Anthropologists should always be considering these factors holistically. Like Soler and colleagues, we explore structural vulnerabilities using the temporal phases associated with the assessment of skeletal trauma, antemortem findings that are indicative of experiences throughout life, perimortem vulnerabilities relevant to the circumstances of one's death, and postmortem vulnerabilities that are related to the treatment and the investigation of remains, as well as the involvement of the families of the missing and deceased. And I'll turn it over to Amy, who will explore these issues in the next 3 slides.
All right, thanks, Mari. Let me just get some cameras on here. So during life, systemic marginalization can result in social, economic, and health disparities in family structure, income, and access to resources and more. Factors related to social insecurity can include, and of course this is not an exhaustive list, but can include disintegrating family support networks, susceptibility to interpersonal violence, and difficulty obtaining proper identification reflecting name and gender identity. And all of this can of course lead to inability to secure employment. Social insecurity issues also underlie economic and health issues. So we see that lack of access to housing may stem from the inability to secure accurate ID cards or even open a bank account. Trans individuals may also experience economic insecurity as a result of discrimination in the workplace, access to potentially only low-wage employment, or even any other barriers that may result in the need to enter unsafe work environments. And these are all nested issues, as social and economic insecurity can also have biological consequences due to poor access to nutritious food, or maybe health or dental care. Because healthcare is linked widely in this country to only certain types of employment, and private insurance is out of reach for most in this country, trans individuals experiencing hardships in housing and employment will almost certainly also experience health insecurity. Transgender people who may also experience discrimination in healthcare, and this can lead to adverse outcomes, including refusal of care or improper care by medical professionals. I think if you're following the news right now, we're seeing some extremely concerning things happening across the country in US state houses, bills being considered and unfortunately even being passed related to healthcare for trans people. The totality of these life experiences can manifest in the skeleton as antemortem trauma and or nonspecific indicators of stress. These skeletal indicators have been noted in other marginalized groups like migrants that Solera and colleagues outlined, and already explained that. But similar data might not be knowable for trans decedents. So in addition, a lack of antemortem care results in non-existent or scarce antemortem medical and dental records, which can complicate identification even in presumptive ID cases. So structural vulnerability may also be visible in the postmortem interval. As a result of discrimination, trans and non-binary people may be denied life-saving care. They can also face increased risk of violence, including suicide, homicide, and intimate partner violence, which can manifest as perimortem trauma. There's a large body of public health data about this. This can all be seen in the cause and manner of death as well, and in the overrepresentation of LGBTQ+ and transgender folks in forensic cases that Jessie did a great job of outlining in her session. So at the same time, bias and errors in law enforcement's initial reporting can also influence the subsequent investigation and identification efforts through the effects of cognitive bias. We touched on that a little bit in the anthropology session. And gender identity may not be accurately recognized in the initial stages of a death investigation. So important context, including gendered clothing and sex characteristics, may be misinterpreted. And finally, we can explore postmortem indicators of vulnerability, including those resulting from analytical limitations in transgender cases, continued issues in reporting and documentation, and complex family relationships. One limitation of forensic science is that biological methods, including all of those that we use in forensic anthro based on skeletal remains, can really only determine biological sex, as we've discussed today, and that might not match lived identity. So gender identity can be confirmed only when an individual has been positively identified, and we start to learn more about how they identified in life. So we emphasize that prioritization of sex without any consideration of context clues actually does not make our reports any more scientific or more objective. After death, reporting and documentation issues can continue to affect case outcomes. Initial and continued misgendering by law enforcement can also obstruct search and identification efforts. We see a similar problem with databases such as NamUs. Again, Jessie did a great job outlining this, but bears repeating here. So while NamUs as a platform assists identifications by providing a national registry of missing and unidentified persons, it can also impede identification because it always prioritizes biological sex over gender. And this problem is exacerbated because an individual's lived identity may not match the name and gender on their governmental records. So postmortem identification efforts therefore uncover an individual's dead name rather than the name they used and were recognized by at the time of death. Family relationships we see too also may impede identification. Unsupportive biological family members can misgender or dead name decedents in missing persons reports. And some biological families may also refuse to initiate a search or even to collect remains once they have been identified. The problem, of course, here is also that chosen family are often not allowed to file missing persons reports, meaning that the person might end up just not being reported at all. So recognition of potential trans and non-binary cases is really only part of this equation. As anthropologists, we have an increased burden of ethical responsibility when we're working with individuals from marginalized communities. So we propose the following. We think that anthropologists and death investigators should adhere to these basic ethical responsibilities in potential trans cases. Again, not an exhaustive list. This is what we've come up with. We'd love to hear from other people about what they think. But so first, we need to acknowledge that the existing binary for unidentified decedents does not encapsulate lived experiences for many individuals, and therefore anthropological expertise alone, understanding skeletal patterns that kind of group male or group female, that anthropological expertise alone will not be sufficient to achieve identification. Second, we need to abide by harm reduction principles in research and identification. Honestly, these are still being worked out in our field, right? Third, we need to work towards the development of best practices guidelines. Again, still being worked out. Would love to collaborate with folks on this. We hope that webinars like these can represent the initial first steps towards that collaborative effort, which in our opinion will take conversations among anthropologists, advocates, activists, medical legal professionals, law enforcement, and LGBTQ+ community members. And finally, any sort of forensic science or death investigation need to recognize the roles that we play and how that can potentially affect case resolution. We believe we can use our positions to advocate for appropriate care, or our lack of sensitivity to relevant issues can also, if we're not careful, can introduce bias and harm that may actually present obstacles to identification. So we propose here some specific harm reduction practices that anthropologists can implement now in their own labs, also in their communications with law enforcement and with their colleagues in casework. We believe that we can perform blind analyses of sex estimation in an effort to avoid cognitive bias. Obviously, this isn't always possible, but maybe it should be one of our goals. We can start to include or continue to include footnotes on sex versus gender in case reports. As Mari noted, this is similar to the common practice for the anthropological definition of perimortem to throw in a footnote in a case report. We can start to include and consider gendered context clues in case reports. For example, masculine or feminine clothing, evidence of gender affirmation surgery, and more. We can also use inclusive and accurate language and avoid using gendered pronouns and terms to refer to unidentified persons in reports, because we know that gendered language in the case file can create persistent bias. Again, shouting out Sean Tallman and his colleagues who wrote a paper that touches on this. But again, like we've seen in the chat, this seems like definitely a space that we can continue to have conversations and maybe even create some sort of standard operating procedures here. We need to, of course, have conversations with medical legal authorities and law enforcement about challenges in identifying transgender decedents. In my experience, law enforcement is a little more open to this than I myself maybe have even been giving them credit for, because of course they want to resolve a case. I'm sure that's not the case across the board, but when I have tried to talk where I'm at up here in New Hampshire, and I've tried to talk to law enforcement, they've seemed pretty open to this conversation. And then finally, we want to, and this is probably our sort of most like specific point, we definitely want to avoid using a checklist approach to assess cases where we try to fit individuals into rigid criteria in order to be considered trans. we know that not everybody's transition looks the same. We know that a lot of those transitions are either like, you have all of these intersecting factors such as resource access and not the least of which is financial resource access that might be playing into your transition journey. So if we start to create a checklist for who is trans, we're going to miss the whole point of what we're trying to do. So checklists can't account for any diversity of presentation in sex and gender. And importantly, if we start to go down that path, they make scientists the arbiters of gender, which is something we should not be doing. So identifying the decedent will also often result in dead naming, like we've said, if the individual has not legally changed their name. So anthropologists should understand this, and they should be prepared to discuss the importance of a chosen name with law enforcement and medical legal professionals, and potentially even advocate for investigation beyond dead names. So we need to recognize too that after a decedent has been identified, further harm may come to them if their remains are returned to unsupportive next of kin. Anthropologists often have no control over this part of the legal process. However, we can understand when there's compelling evidence to back a lived identity, and we can try to prevent further harm to the decedent, their friends, and their chosen family, and their community members by respecting that identity in communications about the case. It should be noted too that each case needs to be kind of considered carefully separately from others. There's no blanket statement we can make about harm reduction here. We have to consider these on a case-by-case basis. And finally, and extremely importantly, and I say this as an anthropologist who's not part of this community, anthropologists need to ask for and accept and recognize the expertise of trans community members and informed advocates during the investigation process. Often, a detailed interpretation of remains, associated clothing and artifacts, and recovery context is really necessary in cases with scant evidence or long postmortem intervals. You need to surround yourself with people who are able to help you interpret what this means. So harm reduction also applies to designing research studies. This is my last slide before I turn it over to Taylor, who's going to talk a lot about research. Research focused on skeletal correlates of gender identity may generate important data, but these studies also pose significant ethical concerns. So we encourage anthropologists to consider the following if they're thinking about doing skeletal research. First, research on trans bodies by definition prioritizes biological correlates of gender. This not only contradicts how gender is currently understood, as we've discussed, but it also very significantly recalls historical abuses in medical research. Research focused on the biological causes and features of non-binary gender and sex is rooted in the idea that these are maybe pathological conditions that must be fixed. And this assumption has served as justification over the years for non-consensual medical intervention, quote unquote, conversion therapy, and eugenics. And it also demonstrates why many in the LGBTQ+ community have a legitimate fear and distrust of this type of research. Also, research on trans bodies necessarily requires accessing medical records, and this potentially represents a greater level of invasiveness than what we might be used to when we're doing something like longitudinal studies. Because those are studies on groups that might be more easily anonymized. And then finally, any research efforts should carefully consider issues of consent, of course, any potential risks to participants, and all researchers should always understand the reasons why some trans individuals may oppose research efforts and not push beyond that. So I'm going to turn it over to Taylor now.
Yep, thank you. So now that we have discussed some harm reduction strategies in forensic casework, I would like to shift our focus a bit to some theoretical considerations for working with trans and gender variant decedents before discussing current and future research. For those of you who have been around for multiple sessions or all day, I'm sorry if some of this is a little bit repetitive, but I think it really gets the main points across and really drives home some of the issues and things that we're facing. So So a report recently released just this month showed that nearly 30% of forensic anthropologists have knowingly worked with transgender individuals in their casework. It is likely that this number is underrepresentative of the actual cases that involve transgender and gender diverse individuals, however, since these decedents are often misgendered by family, law enforcement, and postmortem analysts. Additionally, there are many gender identities, as we've discussed, that exist under the term transgender, which are not always identifiable within the evidence. This means that forensic anthropologists may not have even known that the remains that they were examining belonged to someone who is trans. This dilemma is worsened when we consider that we, as forensic anthropologists, often do not consider gender identities in skeletal analysis for casework or research. Instead, we continuously utilize binary sex estimation, which is exclusionary, limiting, and some may argue outdated. Reinforcing the idea of binary sex feeds into a cycle of systemic violence that harms both the bodies and identities of trans individuals. Cool. To better understand how our methods harm these groups, we can turn to gender and social theory. Many works of literature in this realm define gender identities as encompassing routine actions and experiences that manifest in the physical body. That is to say, gender is a social performance and our bodies are the stage. To tie this into forensic anthropology, we can view skeletal remains as objects that we are assigning our perceptions of sex and gender to. Fausto Sterling explains that cross-culturally and over time, there has never been a single set of absolute guidelines for inferring gender and other lived behaviors from human remains. This is because our knowledge and beliefs are constantly evolving. Therefore, all individuals embody their own gender differently, and this cannot be analyzed in an oversimplified binary, such as the one anthropological sex estimation methods currently use. By placing dichotomous sex categories onto the remains of all individuals, we are devaluing our analyses and ignoring the lived experiences of millions. This leads us to consider that as forensic anthropologists, we are colonizing the bodies and identities of transgender and gender variant individuals. In the same survey that I mentioned a few slides back, it was also reported that less than 60% of forensic anthropologists agree that sex is not binary, which, as we've discussed today, is something that we should all be kind of getting on board with. But this assumption held by nearly 50% of our field that sex is binary clearly holds many flaws, but we also need to acknowledge that this is rooted in ethnocentrism, scientism, patriarchy, and exclusionary social norms that are meant to harm minority and at-risk groups. If we continue to ignore gender identity and only focus on sex assigned at birth in our research and analysis, we are subsequently upholding these nefarious forms of systemic violence. Ultimately, we are doing more harm than we're doing good. Pamela Geller has recommended that one way to rectify the issues that anthropologists are facing at the intersection of sex and gender is by queering skeletal analysis. Geller argues that this method will allow us to stray from the current heteronormative binary, which can be understood as a sexual division of physical characteristics and activities that center ideas and judgments that men have placed onto women. The heteronormative binary is not only obsolete and patriarchal, but also ignores all forms of gender expression beyond cisgender men and cisgender women. Unfortunately, the heteronormative binary is also deeply rooted in many anthropological methodologies, leading our westernized assumption of binary sex to outweigh various beliefs and historical contingencies. Queering our methods will allow for growth, transformation, and modernization within the field, and will ultimately enhance identification efforts. So now I would like to highlight a few pieces of recent research which have centered trans bodies and identities. One realm that has piqued interest within the anthropological community over the last few years is gender confirmation surgery, and more specifically, facial feminization surgery. Gender confirmation surgical procedures are performed to alter one's physical appearance to reflect their gender identity. Facial feminization is one of the most popular gender confirming surgeries, as it alters the contour of trans women's faces to more closely resemble cisgender women. This often involves reshaping skeletal regions on the forehead, nose, chin, and jaw, meaning that surgical evidence may be identifiable to forensic anthropologists during postmortem analysis. The dissertation written by Buchanan in 2014 utilized pig skulls to examine evidence of cranial modifications resulting from facial feminization surgical procedures. The results of this study indicated that surgical procedures would induce bone remodeling, which would be evident to an anthropologist. Compared to the same cuts made on dry bones, the surgical cuts mimicked the surgical procedures and they exhibited distinct markers that would indicate that these were made from antemortem surgery and not postmortem trauma. Cirillo et al.'s presentation at the American Academy of Forensic Sciences 2020 annual scientific meeting explored post-operative indicators of surgery in living patients using radiographs and CT images. Results indicated that no patient showed complete bone remodeling between 5 and 20 months post-operation. Rather, bone scars were evident in the images, suggesting that surgical evidence may never be fully obliterated and thus may aid in identification of trans women. Schall et al.'s 2020 paper also utilized CT images of trans women undergoing facial feminization surgery to examine the effects of this procedure on craniometric sex estimation. When the measurements were placed into 4DISC, which is a discriminant function analysis program used to help build biological profiles, trans women were labeled as males despite undergoing the surgery. This further highlights why we cannot depend on dichotomous sex estimation methods in forensic anthropology, as our methods still misgender decedents despite them undergoing invasive gender-affirming surgeries. The authors also indicate that evidence of surgery was notable on the CT images, such as the one seen here on the screen. This supports previous claims that anthropologists may be able to identify indicators of this surgical procedure. Though limited, sex and gender research in the skeleton has been performed beyond the scope of gender confirmation surgery. For example, Sitek et al. Compared pelvic measurements of transgender men using hormone therapy to cisgender men and cisgender women to determine where trans patients fell on a sex-specific spectrum, with, of course, cis women being at one end, cis male being at the other. Example images can be seen on the slides here as well. This study showed that some of the measurements in trans men were more closely aligned with cisgender men, indicating that hormonal treatments may alter pelvic morphology in trans patients. Though not focusing specifically on trans identities, Bartholdi et al. Recently published a paper comparing the accuracy of logistic regression and discriminant function analysis in skeletal sex estimation. The authors concluded that logistic regression was more beneficial as it was less dichotomous and thus offered more fluidity between binary sexes rather than simply one or the other. Mari, if you could go, thank you. One area of research that we believe may enhance anthropological analysis and identification of trans individuals is hormone therapy. Hormone therapy involves hormonal medications which alter one's physical appearance to more closely align with their gender identity. For trans men, hormone therapy typically involves testosterone-based medications that induce hair growth, muscle growth, and other masculinizing features. Additionally, the increased testosterone within the body suppresses feminine morphology, menstruation, and the hypothalamic pituitary ovarian axis. Alternatively, hormone therapy for trans women includes medications composed of estrogen and anti-androgens, which aid in breast growth and other feminizing physical characteristics. This medication also blocks testosterone secretion to limit masculine features such as facial hair growth. There has been a surge in trans individuals utilizing hormone therapy as it is less invasive and more accessible than surgical procedures. Many doctors deem hormone therapy as medically necessary, meaning that some health plans will minimize or cover the costs of treatment. Additionally, these medications can be obtained and administered privately so that trans patients who do not have family or social support may safely begin their medical transition if they choose to. The doses of medication are also modifiable depending on the individual, and hormone therapy can be used to suppress sex hormones in transgender adolescents. Sorry. The increased demand for hormone therapy has led to increased clinical research into the effects of these medications on the body, specifically the skeleton. Estrogen and testosterone are crucial to skeletal health as they aid in bone metabolism, density, and homeostasis. Therefore, alterations to these hormones within one's body affect bone formation, turnover, metabolism, density, micro, and macroscopic appearance. Recent studies have also suggested that hormone therapy in trans women leads to decreased bone density and an increased risk of osteoporosis and vitamin D deficiency. Alternatively, more dense bone has been identified in trans men. Recent research has also indicated that hormone therapy affects secondary sex characteristics throughout the body. While most research focuses on soft tissue alterations, it can be hypothesized that bones are not exempt from experiencing these changes. Our current understanding of the effects of hormone therapy within transgender skeletons suggests implications for anthropological analysis of these remains. With these in mind, we propose 3 hypotheses for my ongoing PhD research. First, that hormone therapy usage will alter skeletal sex characteristics. This stems from the previously discussed information on the effects of medications and of the hormonal medications on bone remodeling and morphology. Second, we hypothesize that those starting hormone therapy at younger ages will experience more drastic skeletal alterations because the secondary sex characteristics that forensic anthropologists use in our methods develop at younger ages. Therefore, earlier onset of hormone replacement may lead to skeletal elements that are characteristic of one's lived gender identity. Finally, we expect that ongoing usage of current anthropological sex estimation methods will force trans decedents taking hormonal medications into an ambiguous sex category. Frankly, this stems from a fear that the skeletal changes resulting from hormone replacement will not be enough to classify one as their lived gender within a binary system. Rather, these hormone therapies may further blur the lines between the binary. Over the next few years, we will be using medical imaging techniques and 3D casts from living patients to test these hypotheses and obtain an enhanced understanding of the effects of hormone therapy on the skeletons of trans individuals. While we acknowledge that many transgender and gender variant individuals do not medically transition with hormone therapy for many, many reasons, this research can still help quantify skeletal data for trans groups and provide a foundation for continued analysis. Ultimately, we hope to enhance identification methods while also working to dismantle the inaccuracies and misconceptions of current methodologies. In order to continue research on transgender and gender variant bodies, we must keep ethics in mind. Adams et al. Provide 9 guidelines for transgender health research that we strongly recommend all researchers utilize. These outline collaboration, language, accountability, informed consent, protection, allyship, and censorship. Additionally, we urge researchers to be considerate of the trauma and medical mistreatment that these individuals may have experienced in the past, to be cognizant of current literature and data, and to be educated on best practices for communication with individuals, with families, with law enforcement, and with the media. Finally, please remember that we must be empathetic to the fact that talking about trans deaths can be triggering, alarming, and scary to live participants or the loved ones of the deceased. While it is imperative that we research these topics, this may be difficult to digest within the trans community, and we need to be sure that we are acknowledging that. Finally, we have a few takeaways and recommendations for you all. First, forensic anthropologists must work to actively dismantle our perceptions of rigid binary sex estimation. Destroying the dichotomy will broaden our focus to be more inclusive of gender variant identities. We must also pursue research which enhances our understanding of trans bodies and betters our identification methods. Doing so will limit the risks of remains being unidentified. Transgender and gender variant voices must also be involved in research, methodology, and training development, as enhanced inclusion and transparency will be better for all involved. And now I'm going to turn it back to Amy and Mari for the closing slides.
Thank you so much, Taylor. So we further recommend, going back to some of our earlier slides, Amy and my earlier slides, we further recommend considering how a structural vulnerability framework is useful for recognizing the issues involved in identification of trans decedents, as well as in working toward developing best practices guidelines for cases. We've started having some of these conversations in the chat, but of course we urge everyone to join this conversation as well. We also urge anthropologists who are trained in holistic methodologies and biocultural theories to recognize their roles as potential advocates. Anthropologists also need to understand and consider how they might be unintentionally introducing harm and/or bias into existing case files, which can complicate identifications. And finally, studying gender diversity in forensic anthropology requires collaboration, not just from other anthropologists, but from LGBTQ+ advocates, activists, and community members. Collaboration with public health scientists and medical legal professionals should also be something that we consider.
So we invite everyone to join us in open conversation and collaboration about any of the topics presented here. Our emails are on this slide. Please do feel free to get in touch. We'd like to do a symposium at the forensic meetings next year. And so we really want to speak with absolutely anybody interested in these topics and in hearing how everyone thinks we should move the conversations in our field forward. Specifically, we'd like to collaborate on the bullet points listed here, though, of course, there's ones that we haven't even thought of. But what we were thinking, first, exploring ethical duties and educating medical legal professionals and law enforcement about gender identity. Do we have these ethical duties? If so, how should we go about them? Second, the question of including information on gender in the forensic case report. I imagine people have a lot of ideas about that. Third, here's a big open-ended question. How do we avoid the problem of outing decedents to next of kin in the forensic case report? This goes in line with all of the research that Mari and I have been doing on harm reduction. And then finally, maybe we can start to collaborate on how to produce a set of criteria to even review cold cases that may involve trans decedents. Clearly, Lee and Anthony Redgrave and Jesse Veldstra are doing a huge amount of work in this area, and it would be great to think about how anthropologists can usefully assist them in that. So there's a lot more to research and many topics to explore, and we really look forward to hearing from anyone watching today or who might watch this at a later date. And we have a ton of references, I think like 4 pages of references at the end of this presentation. So please feel free to access all of that. You know, we're pulling references from public health literature, homicide literature, all kinds of stuff. So most of it, as you can see, or you will see if you look through it, is not in the anthropological literature. So with that, I am going to conclude my part here, and we can see if there's any questions. I'm not sure, Sam, how much time we have left in this session.
There is only one comment, but the next session is supposed to start in about 2 minutes.
All right, so Angela is suggesting for the AF symposium to make it interdisciplinary. Yeah, that's a great idea. Forensic anthro cases are such a small percentage of unidentified cases in the US, and we really need to engage with medical examiners and death investigators as well. Excellent, yes, would love to do this. I think that that's something we 100% need to consider. So anyone watching, Angela, if you would like to present with us, that'd be awesome. Anybody else watching from medical examiners' offices or coroner's offices, I think that would be.
All right, I don't see any more questions. This is a lot of information to throw at all of you. So thank you so much for everyone who's been staying with us this whole time. We're gonna have about a 6-minute break before the next session. Is that correct, Sam?
Well, it's supposed to start like right now, so we'll just ask Anthony if he wants.
Okay. All right, I'll stop sharing.